The NHS Cervical Screening Programme has been set up to prevent cervical cancer. It doesn't actually diagnose a cervical cancer. What it does do is look for abnormal cells from the neck of your womb, the cervix, and see whether those abnormal cells may, in 10-15 years' time, turn into cancer. The idea being that then we can do something about that and prevent the cancer developing. Most women will have completely normal smears and never have to have anything further done. Human papillomavirus has been found to be linked with abnormal smears and cervical cancer. The human papillomavirus, or the HPV virus as we shorten it to, is very common, and most women will come in contact with it through sexual contact. There are no symptoms, so we don't know that we've got it, and a lot of ladies will clear this infection on their own and it won't cause any further problems. However, what's been recently added to the screening programme is that if you are found to have a slight abnormality on your smear test, they will test to see if this virus is there, and then if it is, they will take a slightly different course of action than previously. If you haven't got this virus there, then they will send you back to the normal screening programme and you will be invited back at the normal frequency to have further smears. Who should be screened? The screening programme is offered to all ladies aged between 25 and 64. Those ladies under the age of 50 will be offered three yearly smears, and those ladies over the age of 50 will be offered 5 yearly smears. These, you will receive a letter to be invited for your smear from your GP practice, so it is really important that your GP practice has the most up-to-date address. The smear test itself is a very simple test. You will require to either attend your GP surgery or a contraceptive clinic. You can request an appointment with a female nurse or a female GP if you require. It is very simple to do. We ask you to undress from the waist below and lie on one of our couches. We use something called a speculum, which we slide inside the vagina so we can see the neck of the womb, the cervix. We then take a brush, which is quite soft and gentle, and we twist this on the neck of the womb to take samples of the cells that are lying there. Some ladies get a very mild discomfort with this, but most ladies feel nothing at all. This sample is then put in a liquid vial and sent to the lab. The results will be back within 2 weeks, and you will automatically receive a letter within that 2 weeks notifying you of the results. If you do not receive a letter, it is really important that you go back to the clinic where you had the smear taken to find out your results. You will be notified whether your smear is normal or abnormal. If your smear is abnormal, you will receive a letter advising you that you have been referred directly to the colposcopy clinic. The colposcopy clinic is based at the hospital in the outpatients department. It will be very similar to the procedure you had done in your GP surgery or your contraceptive clinic, but they will have a more detailed look at the cervix, the neck of your womb, and see whether they need to take any further samples. Depending on these results, they will then decide on whether you will need to have more frequent smears or whether even you require some treatment. The treatment is very simple and again can be done in an outpatient appointment, does not require any overnight stay, and you'll be able to go home within a couple of hours. What makes you at high risk? The biggest risk of getting cervical cancer is not attending for your screening. You will be invited every 3 years and every 5 years to attend, depending on your age, and this is an ideal opportunity to make sure you don't get cervical cancer. Other things that increase your risk are smoking. The age that you first have sex also increases your risk, and if you first have sex at a younger age, this will put you at higher risk of having abnormalities on your cervix. However, the screening programme doesn't advise smears under the age of 25. Having multiple sexual partners will also give you multiple risk of being exposed to this human papillomavirus, and so again this can increase your risk. If you have to take immunosuppressant drugs, drugs that suppress your immune system, we know that this can also increase your risk of cervical cancer. And so those ladies who may have had a transplant or are on HIV medication will be invited to attend more frequent smears. How reliable is the screening test? Early detection and treatment can prevent 75% of cervical cancers. But don't panic, if you get a smear result that says you need to have it repeated again in 3 months, this doesn't mean that you have cervical cancer. This means that the lab has picked up some slight changes. They are not sure whether we'll go back to normal or whether we'll need further investigations. Or sometimes it's just that there's not been enough sample taken for them to accurately look at it. You will be asked to have your smear repeated again in 3 months' time. But don't come any sooner because we need the cells on the neck of the wound to build back up again so that then we can take a further sample. In summary, the cervical screening programme does reduce your risk of cervical cancer. Due to the screening programme since 1980, we've halved the number of cervical cancer diagnoses. 1 in 20 of you may have to have a repeat test, but don't worry, this is only because we're being super safe and making sure we're not missing any abnormalities that may need some further investigation. Regular screening can prevent 75% of cervical cancers, and some ladies will report that they do get some discomfort, but this is usually very mild. The most ladies find that the experience is completely fine.